we become epic slaves. And so all we do is let the medical assistant do no thinking, do some testing, and then walk in the room, say, you got strep, here's your script. Next. That's really the reason, because we don't want to have a conversations because the conversations are difficult. And it's easier to just swab everybody so you're never wrong, quote unquote.
I have a
But if you
question.
have a conversation, you don't get paid for it, you take more time and you're going to be wrong, somebody's going to be mad. But that's better medicine.
Is it effective to tell them when it's appropriate to seek care and when you should sit and wait, when you should just treat with Tylenol and Motrin? Because the conversations that I have with people, at least it seems to me, they're on board with it and they're understanding it. Listen, ear infections, if you're over 2, first treat them with Tylenol or Motrin. If they still have fever and pain after a day or 2, then it's appropriate to seek care for antibiotics. But you don't even need to look, you can save the copay. You can save by the way, this is not medical advice. Please, this is not a doctor-patient relationship, even though it sounds like I'm in your ear and in your head. I am not your doctor. Sorry. That disclaimer, because the lawyers, all these influencers out, I'm just going to get my soapbox for a second. All these influencers out there giving bad advice, do it with impunity. And yet we feel the need to always give these disclaimers. This is not medical, right? So, if they're over 2, you can try treating them with Tylenol and Motrin for a day or 2. And if the pain goes away, you don't even need to know if it's an ear infection. And so for some patients, from some parents, that's a huge relief because they're like, oh, I just hate it when my kid's on so many antibiotics. Now they leave my office making it seem like it's a huge relief, but I don't know if they're going back to Dr. Rogu's office and being like, that Dr. Block doesn't know what he's talking about. He's telling me that my kid doesn't need antibiotics. I know my kid needs antibiotics. I don't know what happens after that visit. And is that what is your experience with that?
I think that old school model where the medical assistant swabs and the doctor gets the result and treats, I don't know, that doesn't exist here on Long Island. I don't know what you're talking about, Dr. Bravo. We have the conversation.
Now that's nonsense because that's what you do at RBK.
No, we talk first. I swab.
The patients come in, they get swabbed, they get the test, they go home, you call them, they're positive.
But my conversation with them is always, I think this is probably a viral illness. Just to make sure, let's do a strep test. I think it's going to be negative. You take 2 Tylenol and call me in the morning. And if you don't get better, you come back.
Okay, and I would argue
wrong with that. Nothing wrong with that. We had the conversation.
I would argue, like Mick Connor says, if you think it's viral, why are you testing for strep?
Because that kid will be calling back in 2 days, 3 days, that he's still sick, and the doctor never checked for strep.
If it's viral, then the sore throat should be gone in 2 to 3 days, right? So as long as the symptoms
they always call it 2. They always seem to call it 2.
Can I make a suggestion? This is where I think a utilization of the medical assistant would be good. You just say, hey, this is calling from Dr. Rogu's office. He just wants to make sure that your child no longer has a sore throat. If they do, I'll have him give you a call. If they don't, then we're so glad that they're progressing as expected. Like that seems like the kind of thing that you could outsource to a medical assistant because you're not asking them to make a medical decision. If you're asking them to swab your patients, you're asking them to use clinical judgment, which is beyond the scope of a medical assistant.
Right.
Yeah.
I know for efficiency's sake, sometimes it makes sense, but.
Have you seen what the ERs do now? It's ridiculous. You see a patient chart and they're there because of an appendicitis. They get the $1,200.
Yeah. And you're worried about a little $3 strep test. Come on.
And it comes back positive for some virus I've never heard of. And it's like, there's no treatment.